80%. Be sure to open the camera right here on your phone. Scan that QR code at the bottom of your screen for the latest information on the Delta variant here in the tri-state area. Now let's bring in our guest tonight. We have Dr. Jurate Ivanaviciene, an infectious disease specialist from Hartford Healthcare, St. Vincent's Medical Center, and Dr. Chris Hahn is an emergency medicine physician at Mount Sinai Morningside. Thank you both so much for joining us. Dr. I want to start with you very quickly. The Delta variant now accounts for 83% of genetically sequenced COVID cases. So these are the samples that have been analyzed in the U.S. now. Is Delta what you are seeing primarily in your health system?
So unfortunately, we're not able to sequence everything, all of these samples. But as we know, the Delta variant is the most common variant that it's now in the United States. So we just know that it's going to be in Connecticut as well.
Dr. Hahn, listen, we know that it's much more transmissible, but how does Delta really differ from the variants that we've seen in prior waves, and in terms of the severity, in terms of just how sick patients are getting?
So I haven't seen definitive data on it causing much more severe illness, certainly nothing to suggest that it causes a more mild illness. I think the real risk is how contagious it is, being basically twice as contagious as the original variant that we had circulating last year. So that is the primary risk. The more people that get infected, the more complications, the more hospitalizations and deaths you're going to see.
I do remember in the early days of the pandemic speaking with critical care nurses and doctors, and they remarked, they were so surprised at how quickly a patient could go from bad to worse. Is that the same case with Delta, Dr. Hahn?
Absolutely. I mean, I think the spectrum of disease is so broad. People that can have, no symptoms or very mild symptoms to, needing to be intubated and have respiratory failure and being admitted to the ICU and unfortunately dying. So it's the way it progresses. I still think, right now it certainly has that same scary potential as before.
Dr. Ivanaviciene, the phrase pandemic of the unvaccinated, it seems to be very ingrained in our lexicon right now. How do you convince people still on the fence, or perhaps who are just a solid no at this point, to get vaccinated?
So the best explanation is that the proof, what happened initially when the vaccination rates were really high, we stopped seeing, our hospitalization decreased, our deaths decreased. So we know that vaccine is really working and preventing this pandemic to go crazy and uncontrolled. So usually for the people who don't want to get vaccinated, I try to explain that vaccine is very important, and not getting vaccinated, you're at risk of getting not only acute illness, but also having all of those complications down the line and many, many years later on that we don't even know about. We know about the complications that we see now a year later, all those long haulers, the mental health issues. We're starting to see the cardiac and the lung involvement. And so we see a lot of things that occur after the people had acute infection and not necessarily have been sick. People have been asymptomatic at that point and been diagnosed because one of their family members were sick and were diagnosed. So I say that the best way to prevent your family members from getting sick, from you getting sick and having a lot of medical issues down the road, you should get vaccinated.
Dr. Hahn, listen, we are talking about a fairly significant rise in cases in a short period of time here because of Delta. But the flip side of that is we are still looking at relatively low levels of COVID, especially compared to where we were. Now, all that being said, given the rise in hospitalizations, convincing areas like LA County and other areas to institute or reinstitute indoor mask mandates, do you think that's something that should be considered here in the tri-state?
So, I mean, I would probably leave decisions like that to the public health officials. Unfortunately, a lot of these decisions are kind of wrapped in a lot of kind of politics and identity as opposed to just a purely public health recommendation. I think as the basically spread of the disease increases, it may change the way that people assess the risk of becoming infected versus the risk of how they perceive the side effects of vaccines. So it's possible that as things spread, it may, motivate more people to get the shot. In terms of whether or not there should be mask mandates, it's difficult for me to speak on that. I would say that people should assess their own individual risk when they go into indoor spaces if cases are increasing. For me, myself, I am vaccinated, but I do have an infant at home, and I've started wearing an N95 again in the emergency department because of the fact that I could be exposed, albeit unlikely that I would be able to get infected and transmit it. I still don't want to tolerate that risk. That's a personal decision that I make.
All right, Dr. Hahn, Dr. I, we're going to check back in with you in just a few minutes. Thanks, and stick around.